Hi, my name is Courtney Quinn, and I'm going to be doing my presentation on the duties of a dental hygienist. I find it interesting because my major is for dental hygiene, and I thought it would be interesting to let everybody know what the duties for a dental hygienist are. A dental hygienist, according to the Bureau of Labor and Statistics, is a licensed professional who cleans and examines an individual's teeth. A dental hygienist, or in order to become a dental hygienist, you must go to school for 4 years. You must start at a regular school and then get accepted into a secondary program. Angela Santiago explained in an article how to become a dental hygienist that after fulfilling the prerequisites of your desired school, you must complete 2 years at an accredited dental school and you must pass the boards and get a license. In order to be a hygienist, you have to have a license. So I'm going to start off by going through the duties of an everyday job for a hygienist. First, the hygienist is going to seat the patient. She's going to go get them from the waiting room and put them in the chair, get their bib on them, ask them if they're having any problems. And after that, she's going to take bite wings, which are x-rays of the back teeth. Typically, they only do the back teeth because that's where most of your cavities are. And you have to get an x-ray because you can't see in between the teeth and just by looking in the mouth. So the x-rays help with that. And if they see any problems in the front, then they will do an x-ray, but typically they just do bite wings. After bite wings, a hygienist is going to probe. And probing is when you measure the amount of bone loss in between the teeth for each tooth. And you use this probe right here. It's got little measurements on it from 10 millimeters. You measure each tooth from every surface on the tooth. It's important to do this because you get bone loss and you want to make sure that you can make sure it doesn't get worse. And once you get past a 3, that's going to be considered gingivitis, which is 4 to 5. And once you get past that, it gets really bad. So they want to make sure that they chart it on this little period sheet and make sure that they keep up with it and make sure it's not getting worse so that your gums don't recede, which is going to cause more problems and sensitivity. After they probe, they're going to scale, which is whenever you use a sharp instrument like this to get off the tartar and calculus that builds up over the time. There's 2 different types of scalers, and one is an anterior scaler, which is for the front teeth, and the second is for a posterior scaler, and it's for the back teeth, for your posterior teeth, which are mostly molars. And there's a lot of different shapes, but they're all just to form around each tooth and to make sure they get a good grip. And the tartar and calculus harden really on there, so they have to make sure it's really sharp and make sure their instruments are kept up. Another type of scaler is a cavitron, and it's for if the plaque is very excessive and it takes a lot more than just an instrument to get it off. A cavitron tip is a metal sharp point, and it's hooked up to a machine, and it sends vibrations which make it come off a lot easier and a lot less painful. The cavitron has to shoot out water though because the vibrations make the metal very hot, so it will make the patient very uncomfortable. After they scale, they're gonna polish your teeth, which is almost like brushing your teeth, except for you use a Prophy Jet and Prophy Paste. The Prophy Paste is a little thicker, a little more coarse than toothpaste, and it's got a little rubber cup on it. It just massages it on the tooth and makes your teeth feel nice and smooth. After you polish the teeth, you're gonna floss to make sure you get everything out from in between your teeth. Make sure you get all the plaque and the Prophy Paste, make sure everything's out and that you're ready to go. And after that, usually the hygienist will send the dentist to come in and check the patient. While that's going on, the hygienist is typically going to talk to the patient and teach them about oral health and ways to fix things and to help them so that they can, better their oral hygiene. And Curtis Ross explained on the website Best Allied Health Programs that they also offer an instruction to dental patients about what they can do to maintain dental health, which research has shown a direct relationship to overall health. This is meaning that most of the time a dental hygienist will explain how they're doing something wrong so that the patient can go home and fix it, so they know not to keep doing it so it doesn't just keep happening. And just as a brief overview for the hygienist, they seat the patient, take x-rays, probe, scale, polish, floss, and that's about it. So, hope you enjoyed.